A wound is a break in the continuity of tissue in the body, and it may involve overlying epithelium like skin. The wounds are usually caused by injury. The tissues affected include subcutaneous tissue, muscles, and even bones. It may be small or large and may be deep or superficial. It may bleed, may be contaminated with dirt and other foreign matter and become infected. Causes are mechanical agents, for example, cuts from cutlass or knife, gunshots, accidents, contusion from blunt injury. The wounds may follow snake or insect bites, animal or human bites. So chemical agents, for example, strong alkalis or acids and other corrosive chemicals. Also, terminal injury from result there's terminal injury resulting in pains. The symptoms are local pain, bleeding, and discharge of pus if infected. The signs that are usually elicited are local swelling and tenderness. Look for injuries, so for example, the head, chest, abdomen, bone, nerves. Also, determine the physical characteristics of wounds, the size, shape, and depth. Investigations are hemoglobin level, if patient has blood group, and cross-match blood if indicated. X-ray of injured parts may be required to rule out osteomyelitis and bone fractures. As a wound swab for culture and sensitivity if wound is infected. The main treatment objectives are to control bleeding, to relieve pain, to prevent or treat infection, to protect against tetanus, to promote wound healing. Non-pharmacological treatment: to apply sterile pressure dressing to bleeding sites and raise the injured parts to control bleeding. If a bleeding vessel has been identified, it should be ligated. The use of tourniquet to stop bleeding is discouraged. Bleeding from a tooth socket: you put a small piece of sterile gauze in the socket and ask the patient to bite it. So wound management: immediate closure of wounds is very good, but this is not advisable if the wound is dirty or likely to become infected. For example, gunshot wounds, animal and human bites, and wounds over 6 hours old. Also, they should not be sewed up. Wash hands well and wear sterile gloves. You clean the wounds with antiseptic solution. Scrub dirty wounds with antiseptic solution and irrigate with dilute hydrogen peroxide and saline. So if there are bits of gravel, glass, or dirt in the wound, you remove them gently. Lift up all flaps of skin. Clean under them, excise all dead tissue and cover the wound with sterile gauze. Anesthesia may be required. Do not use aerosol, which is both irritant and exposes patient to unnecessary borate levels. You dress infected wound as often as needed with normal saline or povidone iodine lotion. You take wound swab for culture and sensitivity test if possible and start amoxicillin while awaiting results of wound culture. First line treatment is a pharmacological treatment. You give tetanus prophylaxis for all potentially contaminated wounds, followed by booster doses of tetanus toxoid as appropriate. And you give paracetamol oral in adults 500 milligrams to 1 gram 6 to 8 hourly. In children 6 to 12 years, you give 250 to 500 milligrams 6 to 8 hourly. And 1 to 5 years, 120 to 250 milligrams 6 to 8 hourly. And 3 months to 1 year, you give 60 to 120 milligrams 6 to 8 hourly. And you give IV fluids and blood transfusion as required. And then you give amoxicillin oral in adults 500 milligrams 8 hourly. Children 6 to 12 years, give 250 milligrams 8 hourly. And 1 to 5 years, give 1 to 5 milligrams 8 hourly. In 1 year, you use 62.5 milligrams 8 hourly. Referral criteria: You refer complicated wounds, for example, wounds associated with fractures, division of tendons, blood vessels, and nerves.